Jok
Yes.
Peter,
Yes.
welcome to Texila graduate program.
Thank you very much.
We have a few questions today.
Yes.
Hope you are all set to answer.
Very happy.
Right.
Yeah.
Perfect. Yes. So, Jok, what motivated you to pursue the Doctoral of Public Health Administration program? What are the inspirations or the motivations you had to pursue this course?
Thank you very much. First of all, in 2016, I was managing a hospital, a US-based, faith-based organization hospital in Warikop, South Sudan. This hospital was funded by a faith-based organization called Partners in Compassionate Care in the US. And while managing the hospital, I felt it was really very important for me to advance the career path in the management of the healthcare system. In addition, South Sudan is faced by a number of public health challenges. And these public health challenges requires skills and administrative skills in managing the public health challenges, ranging from outbreak investigation to health system strengthening. And I felt it was really very important for me to go through this career path.
Absolutely. And what are the reasons that you could think of that you're choosing Texila for this doctoral studies?
Is because one, Texila American University is listed in the World Higher Education Database, which is managed by UNESCO, and this makes it globally acceptable or recognized. And so with also the blended learning skill and models, this break learning or blended learning model really helped me in ensuring that I do my work while also studying, because my work was demanding and I can't leave my work to go and study in class. Yes.
So the flexibility, what basically...
The flexibility really helped me choose Texila American University.
Right. And when it comes to the course, what are the some of the essential public health or leadership skills that you gained from this program? Something that you could remember.
Yes, I can remember the advanced public health skills which I have gained, which range from disease epidemiology to statistical analysis, and also research skills, in which I feel it was really very important that this will be able to bring out the issues in my country through research and the management of the public health aspect as a whole.
Right, so wonderful. And if you could remember, what are the kind of academic experience had the greatest impact on your professional development? Something that you have in the journey of learning, something that helped you in terms of your professional development.
It has really helped me in advancing my skill and career path.
Right.
And one most important thing I can remember, which I have really put in practice recently, is about the administration of mass drug administration, which was integrated with the polio vaccination campaign. And this activity was possibly done through the knowledge that I have gained in my studies in managing the intervention of health activities together. And so I feel like the interventions of these two, making it a success, was really
in your career,
which was really good. Yes.
Right. And if you could remember any of the support that you have received from the faculties of Texila, maybe in university, in your learning and research and in the progress.
First, the good thing is that, like I said, the university has a blended learning model.
Right.
And also flexibility. There is also enough support that we get from supervisors and also mentors, the student coordinator. These have all contributed to my grateful success of this
Right.
Doctoral Public Health Administration.
Right. Anything that you could remember as the faculty support or the supervisor, something that you could remember from that?
The supervisor helped me during my thesis,
Right.
and indeed from my topic selection,
Right.
which is from proposal up to the thesis work, I was guided and supported by the faculty supervisor, which was really very helpful. After doing some work, there will be some corrections made,
Right.
and then sent back to me with guidance
Right.
on how I should be able to move.
Proceed.
And with this, I really see that I am really professional in the field now.
Wonderful. And how has this DPHA qualification strengthened your work as an EPI officer?
This has really strengthened my work.
Right.
First of all, not only as an EPI officer, but in the public health domain in South Sudan, which is a growing nation. This public health course is really very important for me, and it has really improved my analysis, health policies, leadership in healthcare, and health system strengthening. Yes.
Wonderful. And could you recollect any of the challenges that you have faced during your studies and how the university was able to address them or support them in that?
The challenge I face is balancing work with learning.
Right.
It wasn't easy.
Right.
At some point, I almost dropped out.
Yeah. I can imagine.
But the determination and guidance which was being provided by the supervisor
Right.
really kept me on the toes,
Right.
and I was able to really have courage and ensure I complete.
Wonderful. Here you are.
Yes, thank you.
And lastly, what message would you like to give for the aspiring DPHA students?
To my colleagues who are still pursuing the course,
Right.
the Doctoral Public Health Administration, I would really encourage them to really remain committed and focused to the course. And to those who really want to have their career in public health broadened and also blended as well,
Right.
really need to go for this Doctoral Public Health Administration. It has a great impact, and it can be able to really ensure it improves the health and management of healthcare system in all our communities, and especially in fragile settings.
Right.
Yes.